Corporate Parenting Strategy and Action Plan, I think in it, as Lindsay said this morning, you need to be passionate, committed, and you need to engage with people. I am privileged to work with a group of extraordinary children and young people over a number of years. I used to work with people with progressive and terminal illnesses for a long time, and I did a placement in an assessment centre in Dundee, and it was like something that I would never want to see again. So since then I've been passionate, I'll remain committed, and I will try and engage with people until I retire, hopefully not too soon. I want to thank the members of the subgroup. There's a lot of them here today, and just to say thank you. We've worked really hard to produce this strategy and action plan. It's been round a few desks, it's been round a few board meetings and committee rooms, but generally, apart from it being shorter, we've been commended for the work that we did. But we couldn't have done that without the partners, and we've got partners old and partners new, and I welcome the new partners. We've got one of the new corporate parents on our subgroup, and I'd like to thank Carol as well. I wasn't going to name anybody, but sorry about that, but thank you. So we've obviously met with some of the new partners, but we haven't met with them all. So it's our plan to meet and develop even better corporate parenting work, and for us to be stronger together. But most importantly, just before I go through the slides, I want to praise and commend the passion, the commitment, and the engagement of the children and young people. Some of them don't say very much very often, but the people that care for them every day provide opportunities for them to do that, and they can't all speak on the stage, but we have a lot of heroes and a lot of resilient young people, many of whom get through life's challenges, some that we wouldn't get through as adults, so I commend the looked after children and young people. Our statistics for this year are not in the strategy and action plan because they are produced in November at the 31st of July. So we've got this at this time in July, 166 looked at after at home, 153 in kinship, 190 in foster care, 23 in pre-adoptive, in residential, 75 in residential, 2 of whom are insecure, and in terms of care leavers, we're currently working with 66. So behind the statistics then, over the last year we've seen an 11% reduction in looked after at home, and that's about there being an order in place where it's really needed, and not placing compulsory measures where they're not needed. We've seen a 14% increase in kinship care, and we've got a number of people ready to go to panel to be approved. And we've also got an 11% increase in the number of children and young people in foster care. We've seen a 13% increase in children placed with adoptive parents. There's no changes in our houses, they're always full, there's always a no vacancy sign because we work through and get children moved on at the right time, and I'll talk about that later. We've seen a 50% decrease in secure, but we've seen 11% increase in residential placements, and that's something that we're working on at the moment to reduce that. We've also seen a commensurate reduction of 2% in terms of the care leavers. How did we get here, and how did we get to this strategy and action plan? Well, we changed the governance group. There used to be a cast of thousands that worked strategically with children and young people. So we enhanced the governance group, and we've got a leaner subgroup. When we had the original subgroup, we used to have a cast of thousands, and sometimes people would turn up, but sometimes they couldn't. But what we've got now is a dedicated, passionate, engaging group in the corporate parenting subgroup. We've done a breadth of consultation and feedback, and we've had many diagonal slice workshops. Today's a diagonal slice because we've got people at different levels in organisations and from different organisations. So if you've got a diagonal slice, you've got a healthy mix of experience and people able to influence. After we collected everyone's view, we did a darkened room exercise where we nailed the colours to the mast. We had quite a lot of people with their highest priorities, but we managed to get it down to 24, and then we managed to get it down to 12. But we did agree that if you've got another action plan that would choke a donkey, that's what you'll do. You'll choke a donkey, you won't make a difference to children and young people's lives. So, as we've said already, we've got 6 core commitments. They provide the framework, and the 18 actions provide the sat-nav. Hopefully the sat-nav that doesn't tell you to make a U-turn like mine does. I'm aware that we're tight for time. I don't want to rush this, but I also don't want to knock the programme, and I'd rather that we spend the quality time listening today to the voices of the children and young people And the next few slides are in your strategy and action plan, so I plan to cut that bit short so that you've got quality time to speak to people at lunchtime and to continue listening to the young people in the afternoon. So the core commitment one, I'll focus on the outcomes, I think, for the purpose of today. So children and young people and their families participate in decisions which affect them. One of the things that we've not been good at, that we plan to do, is to listen to the voices of the carers, the kinship carers and the foster carers, because quite often they're not heard. And they're the people that are with the children 24/7, so we need to listen more to them. And it's also about increasing our understanding of corporate parenting responsibilities. We've had commitment from the strategy group and from the partnership board, and we've had commitment from the elected members. We're blessed in South Lanarkshire in many ways. The most recent research from the Voices of Children in South Lanarkshire say they want to feel listened to and be listened to, and feel loved and be loved. And they also want to have more choice. They're often in situations where they don't know why things are selected, and what they're saying is, can we know what our choices are, and can we choose what these are? Core commitment 2, individual plans are in place that safeguard each child's wellbeing needs. You've got a child's plan. Do we tick the box? Is that good enough? It's not. There need to be plans that are made of quality. We also need to make sure that we've got plans for children looked after at home and plans for children in kinship care. There's quite a lot of emphasis on the children that are accommodated, and we need to get a bit more parity for the children looked after at home. If we don't get it right for them early, identify and engage, they will become your statistics and become accommodated. Core commitment 3, planning processes for key transitions are streamlined and effective. We've got a pilot going on at the moment. We had a meeting at Woodside School. Woodside School's got a fabulous new meeting room. We are going to pilot bringing reviews into the school during school time, and for children to be asked to leave their class for a short period of time that suits them and suits their curriculum. We're also going to ask the children who do they want to be there, particularly the ones that are looked after at home. They need to be reviewed. It doesn't need to be a team leader, it doesn't need to be anybody above a certain level. It needs to be the right person that are passionate, that are committed, and that will engage with them. So that pilot's just about to go. We're streamlining the review to tie up lack reviews and education reviews. It's the same child, it's the same issues, and it's the same people that care for them day to day. So that's one of our ambitions. The fourth one is about health. We've made amazing steps in terms of health in Lanarkshire with colleagues from our NHS and others. We've welcomed back Irene Campbell back to the subgroup as well, who's been committed, passionate, engaged for a number of years as well. One of the big issues that we have, which seems strange in 2016, was we didn't always know who the looked after children were. There wasn't a good enough communication. It's there now. Health know who the children and young people are. The social workers are referring them for a health needs assessment, and we are identifying what their health needs and including that in the plan. We need to still further reduce the inequalities that are around. Commitment 5 is about education, working proactively to close the attainment gap and celebrate success. The last statistic I heard, we were slightly up for exclusions, but quite a proportion of the exclusions were people with additional support needs. So at the stage 4 meetings, we've been discussing about how can we do that, how can we better support the young people with additional support needs. So it's another work in progress. And finally, it's about positive school destinations. More young people need to access and sustain accommodation that meets their needs when they move on from being accommodated. And more young people will choose continuing care as an option. I was a bit disappointed we couldn't get the stats up for today because I can't do graphs, but you will see that children are staying longer. One of the initiatives that we've got at the moment, which will stay forever, is that we've got 2 training flats. We've got a commitment for 4, but we're going to get them right first. So we've got one in Fernhill and one in Hamilton. And they're flats where children can go. First of all, they can go with their key worker, their foster carer, whoever it is that they're comfortable with, prepare to move on, do some individual work, cook, plan a meal, have fun, watch a film, cry, giggle, stay the night. So they can stay for up to 2 weeks. So the flats have been exceptionally well used. The gap still is that we've not got enough foster carers visiting or taking young people, so I'm just evangelising about that again. And similarly, we need to be bringing the young people back from external placements to try it out. The success of the training flat, less people are moving out. So young people are going to the training flat, experiencing real life, after a while being left on their own, with contact with their children's house, and they're not liking it. They're discovering the loneliness, the isolation, the quiet. For all you live in a children's house, it's really noisy. You really, really miss the buzz when you leave. So the training flat's been an excellent success, and we're going to build on that. So where are we now? We're working through the actions. We're going to try our best to achieve our ambition. We're still listening and being clear about what young people's well-being needs are. We might talk to each other, but we need to listen, and I know today is about listening, and I hope that will continue. We also, as I said earlier, need to listen more to parents and carers. They're often forgotten. It's disappointed to hear the foster carer not knowing that a social worker was going to visit a child in school and take the child out. Not good practice. And it doesn't take very much to join that up. So I hope it's not indicative of it all. I'm hoping it's not. We need to redress the balance, as I said earlier. We need to get things better for the children that are on home supervision and kinship. It's fine to say they're safe, they're in a family, but in actual fact, the problems are there still that allowed them to be on supervision or have caused that. We will continue to inspire and challenge and support our partners. So in terms of the next steps, it was lovely to hear a lot of the words today, because I had this slide, I actually had 2 slides, and I deleted one this morning because I thought I would end up talking too much. But I've tried to capture the best ones. We need to keep building new and enduring working relationships. What keeps us going every day that do this job? It's our relationships. The shared passion, the shared caring, the shared humour, the shared striving to get solutions for the most complex situations. And we do it, and we usually do it well. We need to close the inequality well-being gaps. They still exist. We're still working on them, and they will reduce over time. We need to streamline the planning, assessment and review. We need to reduce the processes. Not only are young people drowning in processes, but the professionals that do the job are drowning in processes. Several years ago, we looked at the processes within residential care, reviewed them all and rewrote them, and it's made a significant difference. We need to do a bit more of that. If we reduce the processes, a social worker's got more time to spend quality time with the child or with other people that are important. We also need to create more capacity and strengthen localities, and we need the localities to be consistent. If a child comes from one area and another area and their care journey is different, or it's not as good as, we need to address that as well. We should be aiming high for all the children. We will be supporting the realigning children's services. We've been working on this now for 18 months. It's a complex programme where 2 years of primary school and 2 years of secondary school children throughout Lanarkshire, South Lanarkshire, have had a survey to see what their needs are, what they've got and what the gaps are. We also random sampled, I didn't, it's too clever for me, we also sampled 500 parents. We've also looked at where do we spend the money, where do health spend their money, where do education spend their money, what money do we get or give to the voluntary sector. So we have to look at that and realign it. That's going to take a lot of guts, because we're going to have to stop doing stuff that we've done for years, and that's quite uncomfortable. It's quite a difficult decision to do, but the subgroup will certainly support that programme. Thank you very much.